Right, indeed. Long COVID remains a task to be tackled by authorities worldwide. In the meantime, though, we focus on the current infection itself and efforts to contain it on the local front. First then, MIN-JUNG, let's begin with an assessment of the COVID-19 situation here in the country as well as that across the world, according to the World Health Organization.
Sunny, the situation does appear to be improving compared to last week when South Korea reported the most number of infections in the world for the fourth straight week. According to the WHO, South Korea logged more than 2.4 million cases over the latest 7-day period, by far the highest of any country. However, the good news is that weekly cases dropped 13% from the previous week. Looking at the broader picture, the number of global infections fell 14% on week, with around 10,800,000 cases confirmed. Although new infections are on a downward trend worldwide, that's not the case for COVID-19 deaths. The number of global deaths increased 43% on week, with South Korea also seeing a 22% rise in the number of deaths. This could be explained by the fact that the fatalities typically lag behind infections and hospitalizations by a few weeks.
Right, MIN-JUNG. And also here in the country, COVID-19 inoculations, as we have been saying, for children have started on this Thursday, right?
That's right, Sunny. As of today, Korea has started handing out the first vaccines for children aged 5 to 11. Registration opened exactly a week ago, and so far, only 1.3% of the eligible recipients have signed up. There appears to be a great deal of vaccine hesitancy among parents of young children over concerns of possible side effects. Still, health authorities are strongly advising children to get vaccinated, especially those at high risk due to conditions like obesity and weak immune systems. And this is regardless of whether or not they were previously infected with COVID-19. However, shots are not recommended for healthy children who have contracted COVID-19 in the past. Children can get vaccinated at around 1,200 medical centers nationwide, and they will be given smaller doses of the Pfizer vaccine administered twice with an 8-week interval, and they must be accompanied by a legal guardian to ensure their safety. As of Wednesday, close to 1.5 million children in this age bracket contracted COVID-19, resulting in 5 deaths. Thursday's data also showed that around half of Korea's population of kindergartners and elementary school children in the lower grades have contracted COVID-19.
MIN-JUNG, staying with vaccines, I understand Korea's drug regulator is mulling over the distribution of 4th doses here in the country.
Right, Sunny, and this comes after the U.S. authorized second boosters of the Pfizer and Moderna vaccines for people aged 50 and above. Korean health authorities say that the latest decision in the U.S. will serve as a guidepost for our own strategy regarding 4th doses. Korea is currently administering second boosters to patients at nursing hospitals and seniors with weakened immune systems. But a health official said Wednesday that the country should consider administering 4th shots to all seniors in general to tackle the rise in severe cases and deaths among the elderly. And as of Wednesday, they accounted for around 94% of all COVID-19 related deaths here in South Korea.
And also, U.S. FDA's Advisory Committee on Vaccines is actually scheduled to hold a meeting next Wednesday where experts are expected to further discuss the future of booster shots in the U.S. And that also may include discussions on whether to expand the second boosters to other age groups. Now, for now, vaccinating healthy adults with a 4th dose remains controversial, but the White House had mentioned on Tuesday that if at some point second boosters are recommended to the entire population, additional funding would be needed. In fact, U.S. President Joe Biden on Wednesday called on Congress to do more to fund the country's vaccination campaign and also secure additional vaccine supplies now as more are becoming eligible for additional booster shots. 79-year-old Biden himself got his 4th Pfizer dose on a Wednesday, just a day after authorities gave the green light for a second Pfizer and Moderna booster shots. Biden also mentioned the potential need for new vaccines to deal with new variants, stressing that additional funding would be needed to purchase those.
Right, I see. And before we focus more on the international front, I have one final question for you, MIN-JUNG. What is the latest with regard to our social distancing guidelines, which are poised to end on Sunday?
Well, Health officials appear to be leaning towards an easing of restrictions, including the limits on business hours. Authorities are believed to be weighing several options, one of which may include an extension of business hours to midnight from the current 11 p.m. shutdowns. However, President-elect Yoon Suk-yeol's transition committee is calling on the government to completely abolish all restrictions on business hours. The committee explained that business curfews have had little effect in curbing the outbreak, but said restrictions should be eased gradually otherwise when there is a clear sign of a downward trend. However, some health experts have warned against hasty action as the country continues to witness 300 to 400,000 cases a day. Officials will conduct their final review this afternoon and make an announcement on the fate of our restrictions this Friday.
I see, MIN-JUNG, and that is probably what you will cover for us tomorrow, hopefully. Now, beyond Korea soil,